My name is Dr. Sabine ZENKER. I'm a dermatologist from Munich, Germany, and I will demonstrate today a full face approach with Pluryal fillers. This section will show the use of the Pluryal filler line. Pluryal fillers are hyaluronic acid fillers, monophasic, cross-linked with a BDDE with a very low endotoxin level. So we will show a case of Pluryal and Pluryal Volume. Our patient shows typical signs of facial aging, such as wrinkling, the lines show up, and the volume and a volume loss. So she has loss of lifting effect in her lateral upper cheek part, a starting of a loss of volume in her frontal cheek part, and she starts to get concavities such as the formation of the jowl, the pre-jowl sulcus, along with the nasolabial fold, and she starts to show the tear trough. The lid cheek junction is not smooth anymore, and she shows a loss of definition of a jawline. So the objective of this session is to give her back a lateral lifting, a frontal projection of her cheeks, an attenuation of the nasolabial fold, as well as the pre-jowl sulcus with a little smart lifting of the corner of the mouth. And we will try to kind of equilibrate and strengthen and redefine the jawline, certainly in the lateral part at the mandible angle up to the jowl. Therefore, we will start to map the face and show the strategy of this injection. So I will mark the no-go zones and the go zones first. So the no-go zone obviously is the infraorbital area, as well as the infraorbital foramen. Another area of danger obviously is the alar tragus, because of the facial artery which is running here. Then there is a strategic line we are drawing to kind of understand where the filler has to be placed, in what kind of manner, how. This is the alar tragus line. This line tells me to stay deep once I replace volume in the upper part of the cheek, and to stay subdermal in the lower part. Then there are the lines which show me how to find the entry points for each injection. The first entry point is defined by the upper and the lower zygoma. The entry point is chosen according to the equipment I use. So in this case, a blunt tipped cannula. So this, I will use a 25 gauge 1.5 inch blunt tip cannula, and as this cannula reaches up to the next entry point, once I do insert it in the middle of the zygoma, I will choose my first entry point here. That's the zygomatic arch entry point. The next entry point is found by it's the cheek apex point, and I can find it by drawing two lines. The line to find the cheek apex point, the entry point for this injection, is to choose the lateral orbit and a line which goes perpendicularly down here, and the second line is the mid-mentum, corner of the mouth line, and where the two cross. This is the highest point where the cheek apex point should be, has been, or will be after the treatment. I can reach out for the whole frontal projection, for the whole area where I will recreate the frontal projection and even the tear trough from this point. If ever we will do a strengthening of the lower part of the cheek, my entry points will be here, and then according to the cannula length, and again I use the same one, we would do the next entry point here. So this would be the augmentation of the lower part of the cheek. I use that predominantly for the wrinkly skin here to stimulate the structure. In this case, I think we will not use these 2 points. For the strategy for the lower part of the cheek is, the lines are the following. I look for the mandible angle, and I use the line running along the jawline, and we'll use this mandible entry point to redefine the jawline. For volume restoration in this patient, we will use Pluryal Volume. We will mix the product, which comes in a 1 ml syringe, using a regular adapter, and mixed with a saline 1% in a 20% ratio. Mix the Pluryal Volume with 20.2 of a saline 1% or another local anesthetics 1%, and do 10 passes each way in order to mix the filler with the local anesthetics in an even way. This is an off-label procedure. It's my personal choice. To facilitate the procedure for the patient, we will numb the entry point by a little bleb. We will then use a larger needle size to make the entry hole. It's a 23. First trick is tunnel the way. Tunnel the way the cannula will move on later. The area, the non-sterile area, because we never want to touch any non-sterile area with our cannula. We're using a 25 1.5 inch blunt cannula. Next rule is to prime the cannula, never inject air. And you see how viscous the product is. It's a volumizing hyaluronic acid Pluryal Volume. It stays where I extruded it from the cannula's tip. Next trick is I hold the syringe like a screwer. I pinch the skin where I want to go deep, I insert the blunt tip gently, and now I do advance the candle to direction cheek apex point, again by pinching the skin, pointing down to the bone and advancing gently. Next rule is control where the tip is. When it sits exactly on this nasojugal groove, then we are on the right level or area, and level wise we're down on the bone. This candle has a hub marking, so I know where the tip, the hole in the tip is, so I turn this down, and now the injection begins. I do inject a 0.1 as a bolus, and now I withdraw the candle and the syringe and by injecting Pluryal volume in a retrograde way in order to redefine her lateral OG curve, give her a lateral lift, and see how that forms a nice curve already. This volumizing filler is a very precise one. See how it does a nice definition of the injected area. And now I go do a second pass, advance the kind of control the tip, and I withdraw. And I do inject the filler in a retrograde fashion, and I do stop before I go out. Second entry point is the cheek apex point. And I do inject in a bolus-wise way, touch the bone, withdraw the candle. The second point is in a banana-wise way. Aspirate again, and inject the material here. It's a 0.1 per bolus. The alar triangle is the next point of injection here. The idea is to soften this line and to give her a more calibrated look, erasing shades. So I do a one-shot bolus out. I do touch the bone, aspirate, touch the bone, withdraw the needle, aspirate, and then 0.1. See how it lifts up immediately. The next area of injection will be the corner of the mouth and the prejowl area. The idea here is to put a bolus exactly in the corner of the mouth area to lift up. Okay? And it's a 0.1 of Pluryal volume. This was a subdermal injection. The second injection will redefine the corner of the mouth. I needle up the red-white line of the lip, and I do inject gently with a gentle pressure on the plunger, just this little line in order to lift up the corner of the mouth. It's like building a house, doing a foundation to re-give volume where it is lost, and then to redefine by giving a topping, again with the Pluryal volume, which is a very suitable filler for this indication. The rest of the area to be filled is the prejowl sulcus. I go at the lowest, deepest point of this sulcus in a subdermal way, 45-degree, higher the needle, and then put in a fanning wise shape the material. I wouldn't use a cannula here because the kind of trauma for the tissue would be far too high. I do immediately mold the area I injected with some Pluryal Day Must cream in order to check what I did. And the next indication is the reshaping of the jawline. The jawline is a very important border of the lower face, and with a well-defined line, it gives a sign of youth. In her case, we have a difficulty that there is the jowl, which ideally, in my clinic, I do treat this problem with injection lipolysis, but what I can do for her now with fillers, with Pluryal Volume notably, is to strengthen the line, the jawline in front of the pre-jowl, and as well as in the lateral area here. So I will go in a fanning way, in a linear fashion mode, linear threading fashion mode, and pinch the skin in order to get the filler placed exactly in the subdermal area. See how the filler goes precisely to the area to be injected, and it's nicely moldable. And the second one up to the chin. It's nicely moldable. And now we will address the mandible angle. As straight to the mandible, to the angle, I touch the bone and place a 0.2 of Pluryal Volume in order to redefine this angle. For the redefinition of the upper part of this angle, I choose the same entry point and place filler in a retrograde fashion in a fan-wise way. By a candid treatment, putting a little bleb in for the entry point for the cannula, using a 23 gauge needle to do the entry point, again tunnel the way, and then I will use again the 25 1.5 inch cannula, blunt cannula. In her case, the 1.5 inch is totally enough in terms of length. Again, I pinch the skin, insert the tip, and now I do navigate in the subdermal level with my index finger and the thumb in order to place the cannula in the right level, in the subdermal level. And now I do place the filler on the bone in a retrograde fashion again. Second pass, again, objective is to redefine the jawline here. Stretch the skin and see how the filler works in perfectly. What we do now is we mold the filler with the Pluryal Day Cream. subdermal placement, a little thread here, pinch eventually in order to hold the fillers in between your fingers, and then we're done. Rejuvenate this lady's face by giving her a lateral lift, more of a frontal projection, a raising of the shade in the alar groove, redefinition of the corner of the mouth, smoothing out of the prejowl sulcus, and strengthening of the jawline. We will inject the earlobe here because a loosening of volume marks an aging overall attitude, or is the giveaway for aging. So what we do here, we simply replace by Pluryal, inject slowly a kind of a bolus at the low, and the entry point is the lowest point of the earlobe. I use a 30 gauge needle. I mix the Pluryal with a 20% of a silokin, reshape, revolumize the earlobe in order to get a younger looking and the earrings better holding earlobe. Be able to see in comparing the both sides. Same product, injection, entry point is the lowest point, and now I do a little bolus, direction proximal, Pluryal with a 30 gauge needle mixed with a lidocaine, 20%. Redirect the needle. Don't do many entry points because earlobes do bruise a lot. Now I use 0.4 of Pluryal in both sides. Tourner la tête. Parfait. Merci.